We're gonna try this again. Take two. We're just gonna try this again. I look a little larger in this screen. Nicole, what up? How's Canada? What's rolling and shaking in your land? This is what we're dealing with today with spirit. So, Patty, Cindy, what up? We are going. Do you hear that? I've been hearing ringing, like high-pitched ringing from this ear. Hello, Gloria. We're gonna try this again. If not, you guys, we're just gonna shake it off. My ears are ringing, and it's driving me crazy. Okay, please, Lord, let's try this again. I'm on my tablet now, so we'll see. And it's funny because I just FaceTimed her or messaged her on Messenger, and she has a camera button, so I don't know what's happening. Let's try this. Is it snowing yet up there, Nicole? Oh. We're adding. All right, guys. Try this again. Let's see.
Oh my gosh! Oh, right. So you can't push the button unless your phone is in portrait mode. That's what happened.
Okay. Nice. Well.
All right. Okay. Well, hope we didn't lose anyone.
I think they'll come back on. We did it again. We made it. Hello. Welcome. I kind of introduced you and then delayed it. So thank you for being my guest. Hello. And
no, thank you for inviting me. I'm so honored.
Yes. Yes. You guys, today is Wednesday. Our guest, Cynthia Foster's Unraveling the Mystery of Your Symptoms. Thank you so much, you guys. Take two, joining us again. And why don't you, Cynthia, tell us a little bit about yourself and just whatever you're guided to talk about.
Oh, great. I don't know if you can see it, but I have a little doctor's coat behind me.
Yay!
And then I thought it would be cute to say, it's important to keep this in the background, right? Because that's kind of where I started from, but I realized that was not what was really working. It was not really very effective medicine. That it was we have a flop over effect from my cell phone. So I went to medical school. And one of the problems with medical school was that I'm an empath. So I feel people's feelings and I feel what the medical treatment does to people. So, and at the same time, I also had epilepsy. So I had kind of a double whammy I was dealing with. So I was suffering with the epilepsy. I didn't know I had it. I was desperate to find out what was wrong with me. I had severe headaches. I was dislocating my shoulders in my sleep. I was desperate to find an answer. I went to doctors for 2 years, and the doctors couldn't find anything wrong other than I have anxiety. So the anxiety picture didn't seem right to me. Just internally, it was like something is very, very wrong. I just didn't know what it was. And unfortunately, their method of diagnosis wasn't very accurate. So I find that a lot of times with people. They don't know what's wrong with them. They go to the doctor. They go from doctor to doctor. They can't find out what's wrong with them. But yet we give them so much credibility. Like, oh, go to a doctor and get diagnosed, or go to a real doctor and get diagnosed. And sometimes this doesn't work, right? So it didn't work for me, and I'm a very logical person. So I went, okay, well, this one avenue isn't working. I'll go in another one. So I started to think outside the box. I started to go to health food stores, libraries, bookstores, and just see if I could educate myself. So I did this, and I found an entirely different world of natural healing that I had no idea existed. I had no idea what herbs did. I had no idea how to heal anything natural. My idea of healing at that time was just go to a doctor. Right. So it was into my third year when I finally found the phone number for a holistic nurse who is operating outside of the medical profession.
And this was when you were
And
in medical school?
this was while I was training to become a conventional doctor.
Wow, okay.
And she diagnosed me. And it was a strange roundabout way of figuring it out. Just with, she said my adrenals were really weak, so I wanted to know if that was true. I wanted to get myself an authentic, real test, right? So I went and did that, and then that doctor actually said, you know, do you have any strange symptoms you can't account for? And I said, yeah, well, I'm losing 3 hours out of every day. I just wake up on the floor and I don't really understand why. So none of this had ever happened with any of my family members. None of this ran in my family, and I had no idea what seizures were, really. So so the nutritionist, the holistic nurse, she actually told me to take a B supplement. It was a particular one. And that night, I actually became aware of having a grand mal seizure. So my whole body was convulsing and very rhythmically. And I finally understood what was happening to me and why I had all the symptoms and the confusion and the brain fog and couldn't think straight and kept dropping things and uncoordinated and everything else. The cuts in my mouth I would wake up with, blood in there.
Oh my gosh.
Yeah, I know. And it's unfortunate that the doctors couldn't figure it out. But so, and then when I went back to her, she said, healing seizures, the first step is becoming aware that you're having them. And I had never heard that in the medical profession because, as we probably all know, there's special seizure medications that you take when you have seizures, and they suppress the seizures. And then if you stop taking your medication, then you'll have seizures again. So knowing what that was and knowing what the side effects were, because I was in medical school and I was learning it, and the liver damage and everything else, and damage to your babies if you have them while you're on the medication, I decided I'm not going to do it the conventional way. I'm going to do it the natural way. And of course, the fear was, is that even possible? Do people even heal from epilepsy? So that took another 2 years. So by the time I graduated from medical school with my degree, I had finally stopped the seizures. But it was it was a very long 2 years. And it was a very interesting experience of having the side-by-side comparison of going through medical school and learning the medicine, the real medicine, and then also going to a holistic practitioner and trying to save my own life. And I wrote a book about it, actually, called Stop the Medicine.
I love your cover.
I know, I love that light. Yeah. I told the graphic designer the topic, and he just chose this. So I had nothing to do with it.
Wow.
But I love the way it turned out. So yeah, I learned that I needed to change my diet. I needed to take supplements. I needed to do a lot of colon cleansing. I did a lot of emotional healing. I did a lot of flower remedies. I did a lot of juice fasting. So I consumed nothing but juice all day long for many, many days. My longest one was 60 days.
Holy cow.
Yeah. I know. I was trying to top my teacher that he had done a juice fast for 60 days. So I was trying to one up him.
Wow.
So, but I ended up cured and the seizure stopped. And my life was completely changed because I'm like, oh, that's not supposed to happen. I was in medical school being told you're the brightest of the bright, you're the cream of the crop, this is the best anybody has to offer you. We have all the answers, and everything else is quackery. So during my medical school years, if I even said anything about natural healing, it was ridiculed, or the professors would give me a bad grade, or they would say, you can't play around with being sick. You need to see a real doctor. So, and there I was going to see this holistic nurse, and she had people coming to her from all over the world, literally people flying in from Europe to see her because she was very well known for curing cancer naturally, without the chemo, without the radiation, without the surgery. And the way she would do it would be detox, colon cleansing, coffee enemas, things like that. And then she had a special herbal formulation that was highly concentrated. So I had that unique experience of what happens to patients when they're going to a really good natural healer. And she had been doing it 20 years. She was amazing. So I was seeing all these people heal, and then she happened to mention the things that she noticed while she was healing people. For example, every single case of cancer that she saw was, she said they had parasites, and they would come out, and then she would say, you know, this is a jar of what came out of this person, and they brought it to me. Right? So she didn't just talk, she would show me the proof. And then she'd say, I used to send these down to Mexico so they would be identified, because every time I tried to do a US based test, they wouldn't identify the parasite. But if I sent them down to Mexico, they would tell me exactly what parasite it was, what its life cycle was, how long it, you know, survived in the host, you know, how it got in there and how it was spread. And they give you all this information about the parasite. But so that was then I realized I actually had parasites, and passed them and went to the doctor and said, you know, these things came out, and I described exactly what they look like. And he's like, well, that's not possible. It's not possible to pass parasites, not unless you were on some kind of medication, parasite medication, right? So in the natural healing world, of course, we know wormwood, black walnut, clove, quassia, there's some pomegranate bark. Those are all parasite killers, and you can pass those parasites. People do that all the time, but the medical profession doesn't know about it, or at least they didn't know about it back then. So I had all kinds of things happen, all kinds of chemicals and things left my body, all kinds of, for example, I got allergy shots and tests for years. And when I did the detox and the cleansing, they all just started erupting out. Like they were literally stored in my body, which is one of the reasons why I'm very emphatic about medications being synthetic, and they get stored in your body, and your body doesn't release them until it's, you know, it's strong enough or it's ready. And just avoid medications unless it's absolutely life-saving. And now we're, you know, just learning about Cipro, because it can cause tendon ruptures and tendon tears, and even something as simple as an antibiotic can cause harm to people. So where was I with this story? I was going through this healing process, and I was writing out the problems with medicine. One of them being that if someone tells their doctor a symptom, if it doesn't show up on a test, which is what the doctors call like an impartial test, so it's objective as opposed to subjective, or what you say, it would be considered subjective, and that could be biased or it could be wrong. But their tests that they do are objective and, of course, very accurate in their mind. So the problem is, if you go to the doctor and you say, I've got this problem, and the doctor says, well, nothing's showing up on the test, that means nothing's wrong with you, then all these people now have, you know, have a ghost diagnosis. They don't know what's wrong with them. If they go to the medical professionals, a lot of them don't understand why they're in pain, or why they're sick, or why they have fatigue, or why they keep having headaches. What they're offering is pain relief. So what we're seeing is we're seeing all these people addicted to opioids because they've been in a car accident, or they've had some kind of injury, and the only explanation the doctors have given them is, well, we don't know why this happens. And that, again, we have something called an idiopathic diagnosis, which is we don't know what's wrong with you. We don't know why. And yet we trust these people with our insurance, our our money, we trust them with everything. And yet half the time they're telling us, we don't know what's wrong with you. We don't understand this disease. It's really rare. It can't be treated. It can't be cured. And so a lot of people have heard that. You have this problem. We can manage it with medication, but it can't be cured. So we see people with high blood pressure on the medication for the rest of their lives, as opposed to, let's say, somebody that goes to a Qigong master or an herbalist, and that person says, okay, so your high blood pressure is caused by a kidney stone. I had one lady that came to me with a kidney stone, and she said she went to a Chinese practitioner. He did a pulse diagnosis on her.
Mm-hmm.
And some of them are really good at this. They can tell you exactly what's going on inside of your body. And they know sometimes years before doctors pick things up, what's wrong with you.
Right.
So she had a stone. I put her on a stone cleanse to dissolve gallstones. And in the first week she passed the stone. She called me up. She goes, I've got heart palpitations. What did you do to me?
Mm-hmm.
And I said, have you taken your blood pressure? So she stops. She takes her blood pressure and she realizes it's gone all the way back down into the normal range and it's actually low. And I'm like, I think you're going to have to stop taking your blood pressure medication. So she stopped it, and as far as I know, she's never restarted it because that was one of the causes of high blood pressure. So if you were to go the medical route, you'd be on the medication. For other people, they get toxins accumulated in their bloodstream. So, or they get the cholesterol buildup, right?
Yeah.
And there's no medical treatment for that except cholesterol lowering medications or statins, a lot of times, which can cause muscle damage, muscle pain. I've had people come to me literally in a wheelchair because they had such a severe reaction to statins. And does it really work? Does it really lower the incidence of heart disease, of stroke? Not by that much. And depending on the study and depending on how many study participants and depending on who funded the study, there are so many variables that affect that. So, so the job of the natural healer is to say, okay, why do you have high blood pressure? And to find out all the reasons, and sometimes it's more than one. For example, maybe you're working at a job that your boss is having you run different places. You're working 3 jobs. You've got a lot of stress in your life. And so you need not only to do a cleanse, but you need to figure out how you're going to manage that stress. So all of the diet factors are involved. Maybe you're drinking 12 sodas every day. I had a friend who came to me, had gone to the emergency room, and I said, were you by chance drinking a lot of soda? And he said, well, I drink 12 a day. And I said, did they not ask you this in the emergency room when you came in with heart palpitations? And he said, no, they didn't.
I'm laughing because my husband. So that's why I'm like, I'd like to know where genetics come into place too. That's my next question.
Genetics, I think, is the hugest cop out in the medical profession. It's like them saying, I'm sorry, you can't heal because you've inherited something. And if we look into iridology, we can see kind of the genetic constitution of the person. We can see whether they're strong. We can see the organs that are weaker genetically. And then we prescribe a fix, right? Or we say certain foods are strengthening to certain organs. So eat these certain foods, avoid these other foods. Or we can see if your lymph is congested, and then we can prescribe, exercises to help cleanse your lymph, or herbs to do that. So, oh wow, new energy's coming in. What is that? Is that from you?
Maybe. We'll just
Usually,
I got something new yesterday. I figured you'd pick up on it. So
yeah,
it's in line with what you're talking about, but talking.
You're accessing information. Usually it takes only like 5 minutes when I start talking to you, and then I start feeling your vibration, And I probably had told you before that it was pretty significant that I was like, wow, your energy is really amazing, because I feel all this heart energy coming from you.
Oh, well, thank you. I'm trying to extend it. Yeah. It's fascinating what you're talking about because you do the physical and I do the energy part of it. So what you're feeling is what
Right,
I received yesterday. I received
right.
a level of healing yesterday, and that's what you're feeling. So I haven't
Good.
told anybody. So everybody's like, "What are you talking about, Tanya?" I haven't even said anything. So I told you she was amazing, guys, and she was gonna feel it. So
So genetics, it's such an amazing sort of, because they're now saying if you're overweight that it's your genes, or a lot of times the women that have a susceptibility to breast cancer, they have the BRCA1 gene. And recently they found out that half the women that had that gene, actually it was a harmless variant. So when we look at the medical profession, it's a very physical method of healing. It's like, oh, you break a bone, let's put the bone back in place. And in some ways that's good. In some ways it may be not so good. Or they say, oh, your gallbladder is causing you pain, so let's cut it out.
right.
And what a lot of people don't know is that some people with gallstones, even though they have their gallbladder cut out, will still suffer from gallbladder pain after, or phantom pain. They will still have pain. And I had a very interesting case recently of a lady who came to me with gallbladder pain, severe gallbladder pain. It was keeping her up like 3 nights a week. And we did all of the stone dissolving herbs. We flushed out the gallstones. We did all of that. She still had pain. And then we had to think outside the box. We had to think like beyond the physical. Like, what else could this be? And I started to scan her, right? So I start looking and I'm like, oh, what's this thing going on with your ribs? And we started doing a little healing, and the rib pain wrapped around to the spine. And then there was all this stuff in her spine, and all these car accidents were involved. And finally it wrapped back around to her breast. And then I went, oh, wow, you've got something wrong here. And it's not your gallbladder. It was a tumor, actually. So she thought, and she might have had her gallbladder taken out, right?
Right.
But they wouldn't have found it. That's the problem, is that you're looking at a very physical way of diagnosing and treating. And so if you have a physical pain and nobody has the ability to figure out on other levels what's causing it, they may think, oh, it's this organ because the pain's located here and the pain is here, right? So, but there are things that doctors don't understand about pain. So you can have a normal x-ray and have pain, and then they go, we don't understand why you have pain.
Right.
Then you can have a grossly abnormal x-ray with, like, half of a spine bone missing and not have pain at all. So there are a lot of aspects to pain that the medical profession simply doesn't understand. And that's the realm of the natural healer, or the psychic, or the medical intuitive, is to figure out what's causing this.
So when you say you scan somebody's body, so if somebody were to come to you, and I want to talk a little bit more on how do you, obviously because you have your medical background, you do that, but how do you scan and how do you treat somebody? Like, how does that work? So if I was your patient, what would you do?
Well, when I decided to leave medicine, it was because I felt that medicine was kind of barbaric. And I'm sorry to use that word. I don't want to offend anybody, but I felt that the methods were too aggressive, and that they caused too much pain and too much suffering and too many side effects when I compared it to the natural healer that I went to. So when I left medicine, I came to California and started learning. And I wanted to do the healing in a way that was not invasive. And I didn't want to have anything to do with medicine. So I wanted to do everything with prayer. I wanted to just like connect up to God. I wanted to pray over people. I wanted to find out what was wrong with them. For some reason, I wanted to do it this way. For me, that felt like gentle, that felt kind and compassionate. So I was able to heal people with my hands. So a lot of times if they had pain, I'd lay my hands on them, and mysteriously their pain would go away. So I wanted to learn about that, and so I picked up some techniques here and there. And what I do is I have a way where, can you hear the truck there? Sorry about that.
No, you're good.
So I have a way of connecting up to God. It's kind of a space beyond time, beyond the laws of the universe. It's beyond reality, and it's a pure space of just unconditional love, and healing. And I ask, I'm like, please show me. And so I did this for a long time. I'd lay hands on and I'd say, God, please show me what's wrong. And I think because I was an empath, the first things that happened was that I started feeling. I started feeling what was in the pain. So somebody would have, I had another lady, she had gallbladder pain, and I looked in there and I felt fear, like she had a lot of fear in there.
Mm-hmm.
So I would sense things like that. And sometimes there were things that people had forgotten. A lot of times you go through something traumatic and you want to just leave it in the past, right? You don't want to think about it anymore. You want to move forward. You want to think positive. So these are traumas that have left their mark in the body and are still alive in a way, because they're causing pain, they're causing disease and discomfort. So I went, wow, okay, there's fear in there. So I would bring it up with people. What are you afraid of? And they'd say, I don't know.
Right.
So then I would try to look deeper. God, please show me more. Please show me more. What's going on? Over the years, they would get more and more information, or I'd start hearing. I wanted to know, like, what in their mind, what belief in their mind is causing this. And then I would start to hear things. I would start to see things. Like in one lady's gallbladder, I saw one of her husbands slapping her across the face. Mm-hmm. And I went, wow, did you have a husband that hit you? And it was one that she hadn't told me about. And she said, yeah, I did. I wasn't married to him for very long. And it went good. Mm-hmm. Because he left an impression and that trauma left a pain in the body. And in her case, turned into a case of chronic shingles, where she had suffered from so much abuse that undergoing that abuse, suffering from that abuse for so long, left so much trauma in her body that she was in pain all the time. And so I think the message here is, if you're in a very conflicted relationship, for your own health, you need to get out or somehow change it, or get therapy or something, and not just endure. Like I think a lot of our forefathers did, a lot of our ancestors did. Right. They had to be married, they had to stay married, or they had to work at a certain job. I mean, they didn't have as many options as we do now. So they endured, kept a stiff upper lip, that kind of thing. So yeah, so those are the things that I would do. I would look in and I would see what's causing it. Sometimes I go back through the years to see if we can find the original trauma. So your subconscious mind makes associations. So even though, for example, okay, I saw a guy who had slammed his finger in a window, and he was at an expo, or like it was like a workshop that I was at. And I'm like, oh, I can see that you've broken your finger and that you must be in a lot of pain. And I asked him, I'm like, did you get any sleep last night? And he goes, no, I was in the ER until 4 a.m. So I'm like, do you mind if I just take a look at your finger and see if there's anything I can do? And let's just start laying hands on it. So I lay hands on it. And come to find out, he's had a prior injury from playing basketball where he jammed his fingers really bad. So we were able to take like half the pain away just by laying on of hands. And then we got to that trauma, and then the pain really started to release. So, so people may have had an earlier injury, or they may have had an earlier emotional injury, mm-hmm. where something reminds them in their subconscious, something reminds them of that prior trauma, and it gets linked in the mind. And then you kind of have like a whole chain of events, of things that have happened, and they're all causing that pain or that problem or that cancer, which is usually suppressed anger, or it's somebody that's been really, really nice their whole life. They didn't learn how to say no, and people walked all over them, and they just endured, right? So, so these things are healable, and I don't think that genetics is a good excuse, because I've seen a lot of people that were told, for example, they have the kind of high cholesterol that's genetic.
Right.
And then I put them on a cleanse, and their cholesterol just goes down. Right.
Right.
And it shouldn't be possible, because it's a genetic thing, right? But you don't know what's possible until you try. And after 20 years of doing this, I'm going to tell you, there's a lot of things that are possible. Just because you have something genetic doesn't mean it can't be healed. Right. I believe, and I've seen it, that foods, a positive dietary change, juicing, essential oils, herbs, emotional healing, all of it can affect your DNA. I believe that your DNA is very dynamic, that it can change. And what I've learned in iridology is that you can actually see those changes in the iris. So when they take pictures, the blown up pictures of the iris, they can kind of see signs of healing in the eye, and they can kind of see if your genetics have gotten stronger, and then you can see it in the next generation. So we have the ability, even if we have something genetic, to pass on stronger genetics to our children who also have the same opportunity, until that completely leaves the ancestry. And then there's something called ancestral healing, where you can actually go in and attempt to heal your ancestors. And then you can get a more direct healing for things that are genetic. So those are some really interesting healings themselves. I even heard of a case of hemophilia, which we all know of as being genetic, and there's no cure, and blah, blah, blah. And I heard of this case from a healer who did constellation healings, and he went back through her ancestry and found some ancestors that were in a war and killed all these people, and she was a manifestation. She was a manifestation of all the people, all the blood that was shed. Oh. And yeah, some natural healing gets like really out there, but the bottom line was, and I believe she was 13, and with her first menstrual period, she almost bled to death. Like shed some really severe hemophilia, and she did this healing, this constellation healing, and it stopped. The bleeding stopped. So you never know what's causing your problem, and it could be past lives too. I've done some of those, whether you believe in it or not. I find it a useful construct.
Even if you don't, I promise it's in there.
I do it as because I find it useful. I had somebody come to me with migraines, and I went and looked in his head, and I'm like, track me back to his past lives and show me if there's anything there. And I had some visual of him falling off of a horse, and the horse stepped on his head. And I went, you're going to think this is so strange.
Yep.
Because this happened. And he was kind of already sensitive that way. So he goes, oh, okay, sure. Great. Well, sometimes the weirdest thing is people go, I kind of have always had this feeling about that. And his migraine stopped. And years later, he hadn't had any more because we got to the root of that one, which
Awesome.
is great when that happens, when you can collapse down the whole pattern. That's what we'd like. We'd like people to just be
Done.
completely out of pain.
So I have a lot of people are like, oh, that's amazing, and kind of wondering where you're in Los Angeles, in
I
California,
am.
and
I
you
am.
do remote healing.
I do remote healing. Usually I like to see people via Skype because it
Right.
helps me if I see them.
Oh, right. I'm the same.
Yes.
I do all my readings on Messenger, or on Messenger app or Skype or whatever. But I'm saying they could see you like this and set
Right.
up an appointment,
Yes.
and they
And
can
I
do
can.
websites because I have all your
Mhm.
how for them to get connected. And how much do you usually charge for a session? Or maybe I'm putting you on the spot. You don't. I mean, how
I
does that?
have I have hour-long sessions. I
Okay.
like the first session to be at least an hour, just because I have like an 8-page questionnaire where I ask people questions about everything,
Yeah.
almost,
Yeah.
and what medications they're on and what supplements they're on and all of that stuff, and what their diagnoses are, and what organs they have left if they've had any taken out, and all of that. So I have hour-long sessions for 250. I have half-hour sessions. I don't know what those are. It's probably half that. And then I
Okay.
have 15-minute ask me a quick question.
Okay. Awesome. Perfect. I was trying to think what else did Spirit bring up. I know somebody asked about essential oils. Is there any like essential oils? And I'm hearing stress related. So if somebody like grabs something, you have or is stressed and they want to grab an essential oil, do you recommend a certain one?
I have one that I've been working with lately. This is such a weird story. It used to be called Migrastop. It was the blend I formulated for the migraines because I had so many when I had the seizures. And then I realized that if I put it on my chest, that it opened up my heart. And so I like this one. It's called Open Heart
And you
because
make
it.
oh,
Mhm, mhm,
okay, so
that's.
question because I can already hear it. Spirit said it. Do you sell them?
Oh yes. Uh-huh.
Okay.
I have about 85 products on the website: herbs, herbal cleanses, colon cleanses, liver cleanses, kidney cleanses, essential oils, herbal teas.
Do,
But I
sorry
have like,
for interrupting me. Do you recommend somebody seeing you before they order something?
I have people do it both ways. It really depends on you and if you're intuitive, because some people are good at, they're like already seen a lot of natural healers. They're very intuitive. They're in touch with themselves. They're like, I just know I need this formula. I've had people just
Mm-hmm.
say, I know I need that one. I need an adaptogenic formula, and they're done. They don't need anything from me. And
Sweet.
then other people are like, I have no idea what this is. I don't know what it does. What do you recommend? And a lot of times I can just go, oh, you need this, right? And just, save them a lot of time. And then sometimes people have taken the supplements and it hasn't worked. And so they're wanting to get another opinion. Like, what do you think this is? I've tried this, and it didn't work, or it worked a little bit. And sometimes I'm like, oh, well, you did the right thing, but not long enough. Or, you got some of it, but not all of it. Or the biggest problem is that people think I have a nose problem, so I need to take nose herbs, without realizing that the entire body's connected and that even the state of your colon can affect your nose.
Right. That's why I'm wondering if they just grab something that's not working, they may need to visit and figure out what they actually need. Mm-hmm.
Right, right, right. Or that their lungs are connected to their large intestine, their kidneys are affected to their ears, their eyes are connected to the liver, your brain function is connected to your liver, diabetes, cholesterol. A lot of this stuff is um, rooted in areas where you don't feel the problem. So sometimes it's a little difficult to figure out where it started. Like some people start off with high cholesterol and they don't realize their thyroid's actually low. This is
Well,
pretty
it's funny.
common.
I keep hearing thyroid, because there's so many people who have been,
So
like my
many
mom
people have
included.
it.
I may be setting up an appointment with for with my mom, for you, whatever I'm trying to say, for my mom, with you. So yeah, thyroid, that can be a tricky thing with hyper. You see a lot of thyroid cases.
I see overactive and I see underactive. I just saw a case the other day where I was looking in. I'm like, show me what's going on here. Show me what's going on. And then boom, I'm like, oh, you have a slight goiter. And so I examined his thyroid, and he had a little swelling in there. And I'm like, yeah, you've got a little bit of a goiter in there. And he's like, well, I've been told that I don't. And I'm like, you do.
You do.
You do.
That's, yeah.
So, but he's doing really well. We did this technique where we kind of adjusted, or we started talking to his thyroid, saying, would it be okay if you kind of like turned up the volume a bit? And there were certain reasons why it was that way. For one, he was grieving. He had just lost a loved one, and he was depressed. So all of these things are important. It's just people don't connect the dots. They think like, my life has nothing to do with my health. Your life has everything to do with your health and what you're going through. And the whole process of grieving. And I'm like, okay, so are you done with that? Do you want to be done with that?
Right.
And some time had passed, and he goes, yeah. And I literally felt his thyroid amp up. It was pretty amazing.
Oh, that's awesome.
Yeah. He was pretty wiped out. I would say that's probably the number one complaint that bothers people the most. Like, I don't have energy. I'm tired. I need more energy. And that's why there's so many energy drinks out there. It's just people are tired, and it's important to get through the day, yes, but it's also important to know why you're tired and not just cover it up. So it could be your adrenals, your thyroid, those things. And so, again, it's important to ask that question, that eternal question, why? Why do you have this problem? Sometimes people have an inkling of why, and sometimes, they need a little, extra input to know like what causes these problems, or what seems to be effective for healing macular degeneration, right?
I got some exotic light going on. The sun is like right there, so that is fantastic. I think that healers are we're so needed in the world, and especially special gifts like you have, and especially having a medical background, we need more of you. We need to clone you. You need to open up to other doctors.
We'll start some classes.
Say what?
I said I need to start some classes.
Definitely start classes. That would be, especially healers that are already healing. This could be another modality that they use during their healing process. It's funny because Spirit keeps bringing. Why don't you tell? I know we've been on here a while and people have to jump off and do this, but I think this is important now. Tell people, you told me, and I just thought this was absolutely fascinating, being in medical school and seeing the child that you were telling me about. Wow, that story is fantastic, and I would love it if you would share that one.
Which child are you talking about?
The one that was having, the one that went into a coma.
Oh, the 9-year-olds.
Yeah,
the 9-year-old boy. I didn't really know I had these abilities until this happened, right? Okay. I knew I was a sensitive child, right? I was sensitive. Things affected me more. If somebody was suffering, I would feel it, and it would upset me, and I would cry about it, like somebody's suffering, and so I'm not happy. But I was doing a rotation. It was a pediatric rotation. It was a intensive care, and it was at this Catholic hospital, and all of the kids were very, very sick. It would just break your heart to walk into that unit because they were all on respirators, all on life support machines. A lot of them had cancer. Some of them had severe life-threatening infections. And this particular boy was in a coma. He was in an artificially induced coma because he had what's called status epilepticus. And what that means is that he had epilepsy and he had seizures so many, one right after the other, that they couldn't be stopped. So with all their medications, the Valium and everything else that they were using, they couldn't stop his seizures. So they had literally had to put him into a coma to stop him from having seizures. If you have, if you keep seizuring, if you keep having seizures for long enough, it can kill you. Mm-hmm. So to save his life, they put him in a coma. And there are herbal ways to stop seizures. I've done that before, obviously, because that's my thing, because I had seizures. So I see a lot of people with that. But so he was in a coma. He had the feeding tubes, everything in there, the IVs, needles, tubes, everything. Thank goodness they're not consciously aware of it, because it's pretty miserable. But so one day the doctors said, we need to reposition his feeding tube. It's in the wrong place. We feel like it's in the wrong place. And so the medical student always gets a job that nobody else wants. So what is that? A lot of times it's hold down the patient while we do this invasive procedure. Hold this baby still while we stick a huge needle in its spine, figure out why it has a fever. And in this case, it's hold down the comatose patient so he doesn't fight us when we, manipulate the feeding tube. And there's a tendency to fight that. So there I was in the room with a little 9-year-old boy and the doctors, and his mother was there, and I'd seen her every morning, and she was, she was obviously very affected by this. And see, I'm feeling it now. Even now, I'm feeling it. Like I just wanted to do something to help, right? Because she was crying all the time, this little 9-year-old boy, and I had the seizures, so I was really relating to this. So they had me hold him, and I had my arms around him, and I just was like, in this moment, I went, God, please, please, send me something, like send your healing power through me and heal this little boy. And so it was this very intense moment, right, where they were doing this, and I was holding him still, and he was squirming, and he was fighting me. And I was like, please, God, please, God, please, God, heal this little boy, send me the energy, send me the healing energy. And so nothing really happened in that moment, right? And I'm like, okay, well, I did everything I could, right? So... like even still, I get emotional about this little boy. The next day I walked in, the resident was pacing up and down, and she was all, he's out of the coma, he's out of the coma. Because they had kept trying to get him out, and every time they tried to reduce the dose, he would go into seizures again and have to put him back under. So they couldn't get him out of the coma without risk to his life. So they had to just keep him in a coma, and he had been there for so long. So they got him out of the coma. He didn't go into a seizure. It was all done. And I walked into the room, and this little boy was sitting on the edge of the bed, fully alert, fully awake. And I went, oh my word. Like, what happened?
Right.
And everybody's walking around going, it's a miracle, it's a miracle. And I'm like, okay, there might be something to this.
Right.
I can't explain what happened, right? So then it started a long journey of like, what happened? Could this, could God heal this way?
Yeah.
And turns out that it is.
Conduit of light, channel of God's healing light. I love it. I love it. Oh, I love that story. So I wanted everybody to hear that story. Thank you so much for all the work you do. Terry put in the comments, you guys, for website. It's also on the page that I posted yesterday. Ways to contact her if you guys are in pain and have seen multiple doctors and don't understand where or need her assistance. Shoot her a message. She will be a guest again. We will definitely be talking again. We are talking about doing a show in California, so this will not be that you guys will see us together. Let me see what else does Spirit want to say. Shoot her a message. Is there anything else you wanted to say to the guest or to me?
I'm on Facebook, LinkedIn, Twitter. I've got like a little Pinterest page. It shows you how to heal a sprained ankle naturally.
Nice.
I sprained my ankle a couple times, I know. I use my own healing as an example.
I love that.
Also, I have the book.
Yes, where do they buy your book at?
It's on Amazon. It's also on my website.
Okay.
So this is the second edition. I like this edition. It's got extra information on there. It's got information about the exact cleanses that I did that healed the epilepsy.
Okay.
And you got to sign up for my mailing list, because the mailing list, I send out emails every week that teach you about the cleanses. So it's very educational. And so then I say, why does a colon cleanse help this or that? Or why should you do a liver cleanse? And, what to do with essential oils, or how to use them, or how to know what herbs you need. There's a questionnaire on the website. You can take the quiz and it'll give you herbal recommendations. So there's a lot there. I do have a discussion board. I may actually check if people want to post their questions on the discussion board. I stopped it for a while. I may start it up again, where I give quick recommendations for. I saved a woman's gallbladder that way on the discussion board. And she goes, the doctor's telling me my gallbladder is going to go gangrene. I'm going to die from this.
Oh my gosh.
And I go, really? When's your surgery scheduled? And she goes, 2 weeks from now. And I'm like, oh yeah, you're really at risk of dying.
Yeah. No. Oh my God.
No, and so I told her what to do on the discussion board, and she actually did it, and she flushed out her gallstones, and she was fine. And her gallbladder never went gangrene, and so sometimes people contact me just because their doctors have put the fear of God in them. They're terrified of what they have, and they just want to know, like, is there anything else I can do? Like, I don't want my gallbladder cut out, or I don't want to, I don't want to have surgery, or I don't want to get a hysterectomy, or is there anything else I can do? Yes, absolutely. There's a lot of things you can do.
Yay. Oh, that's awesome. Thank you so much, Cynthia. I appreciate you being our guest. Thank you, everybody. You're welcome.
Thank you so much.
Yes, I'm glad you're here. I'm like, this is so exciting. A lot of people had to go back to work, and they're going to finish watching their replay. But thank you guys so much. Contact Cynthia. Get obviously hooked up with her mailing list or email list. Thank you, and we will talk soon. You guys have a fabulous day, and thank you. All right, bye.
You too. And if anybody's following me, check out Tanya's page as well.
Yes, definitely. Thank you guys so much. We'll talk soon. Okay, bye.
Bye. Have a great day.
You too.